The American Cancer Society estimates that 10,470 children in the U.S. under the age of 15 will be diagnosed with cancer this year. With September being Pediatric Cancer Awareness Month, we thought it would be a good time to talk to Dr. Scott Cyrus about what to look for and just kind of help parents navigate this. Good morning, Dr. Cyrus. Thanks for being with us.
Good morning. It's great to be here. Thanks for asking.
Talk a little bit about the common types of cancers among children.
You know, probably one of the most common cancers is leukemia, and that is a cancer of the blood where the cells start to change and they start to get basically out of control, and then they don't function the way they're supposed to function. We also have, you know, brain tumors that are fairly common. So those are kind of the top two, if you would, and then other tumors of the central nervous system, and then lymphoma, which are lymph nodes that get out of control.
Do we know what causes pediatric cancers?
You know, we have this idea that there's some inheritance. There's probably maybe 5% inheritance of a gene that maybe causes cancers, but for the most part, the cause is really unknown. We feel like it's a mutation. There are some conditions like Down syndrome that has leukemia as a part of their condition, so there can be a genetic component to it. So we're concerned from that standpoint, and we're always on the watch if we have a Down syndrome patient for those kind of cancers.
Let's talk a little bit about prevention, because I know, as is often the case for adults, if you don't smoke, then that lowers possibly your risk of lung cancer. What are some of the things that maybe even expectant moms can be doing to lower the risk of their child having cancer?
You know, folic acid is an extremely important part of pregnancy, and we typically have the mothers taking prenatal vitamins, which have the folic acid in there, as well as other things like iron. But folic acid has shown to be an important part of maybe cancer prevention. Obviously, breastfeeding, if we can give the baby the best breast milk we can, that's great. Not that formulas are bad, but obviously it's just not like mother's milk. When we look at obviously smoking, as you had mentioned earlier, prevention not only of smoking around the child, that secondhand smoke does affect the child tremendously, not only like just from colds and runny noses and coughs and things like this, but can cause mutations of cells. And then chemical exposures. You know, we look at trying to decrease the exposure of radiation just from x-rays and things from the medical side of it to help prevent any type of mutation of the cell.
The American Cancer Society has a specific list of signs and symptoms, so I was going to share that with our viewers. And I always caution people, because, as is often the case, you see some of these symptoms singularly, and you may get too worried about them. But by the same token, you do need to pay attention.
That's right. I mean, you hit the nail on the head. You know, if I said that excessive bruising, you know, we look at toddlers and they do fall and they have the bruises, but these bruises heal and they go through the process of healing. It's the idea that bruises come and they don't go away, and that's the concern that we have. Unusual lumps or swelling. Again, children have lymph nodes. It's very common for lymph nodes to be reactive, and you can feel a lymph node or maybe see a lymph node, and many parents feel like, oh, that's a sign of cancer. For the most part, it needs to be checked out, but for the most part, they aren't cancers, thank goodness. You think about paleness, loss of energy, again, illnesses that like COVID or the flu obviously can make children run fevers and be pale, but again, the progress of the disease is short. It's only about 7 days, and so again, this is something that we see over time. So it's concerning that if a limp should be checked out. Many times it's just an inflammation maybe of the joint, but it could be something more serious, though.
I want to ask you before we wrap, because about 30 seconds, I know that what does the future hold? Because in terms of the numbers, it can be kind of alarming to see that the rate is going up, the number of kids, but the survivability is really also improving.
You're exactly right. When we look at the incidence, the ability for us to diagnose cancers, that actually has been going up about 1% every year. But on the other side of it, we're having around 85, 86% of survivability. When we say survivability, we're looking at a 5-year survivable rate. And so when you think about our ability to diagnose cancers and maybe have early recognition of the cancers, this takes the parents and takes the family members to recognize it so that it can be presented to the physician and worked up and treated very aggressively so that we have that survivability rate and have good outcomes.
Dr. Cyrus, as always, we appreciate your time. This month, we'll see you again in October.
Remember, wear gold for Cancer Awareness Month.
Very nice. Thank you, sir.